case of asthma reported with severe allergy of eggs. It started at the age of 3 years with pediatrician advised to give eggs as the child was not growing well. The child was given eggs around 9:30 a.m. and by 12:30 the child had wheezing, uncomfortable feeling and breathlessness. The child was rushed to the hospital and the doctor diagnosed that there is a bronchial asthma, severe rales, bronchi. The patient was admitted in the hospital for the treatment to be discharged after 3 days. The next incident happened when the child was given a cake. Again, a violent reaction, and it may have contained eggs. During the initial phase, it could not be diagnosed that it was because of eggs, and this incident happened again when the child was at a party. The parents had to rush to the children's party as the child was having marked breathlessness with multiple vomiting. He was again rushed to the hospital and admitted. As the child was too young, parents tried to analyze all these incidences, and only common factor turned out to be the eggs. The first step parents took was to stop the eggs immediately. It was repeatedly observed that whenever the child was having eggs in any form, the reaction would be only sudden wheezing and severe breathlessness. This child came up to me when he was 10 years old. He looked very thin, weak, not at all grown up for the age. He was very small, very tiny looking child. We studied the case. It turned out to be Ferrum metallicum. Because of his hypersensitivity, sudden and violent reactions. If we give higher potency, the system may react violently and there could be severe aggravation. So avoid this aggravation, 30 potency was selected with a guided repetition which relieved the patient. You can see Ferrum. We gave Ferrum Met 30, 2 doses. The improvement started. We had to treat this patient for nearly 2 years with multiple doses of Ferrum, gradually increasing to 200. At the end of 18 months, the child was completely recovered. He was given eggs, showed no reaction, no aggravation. Gradually, we gave eggs in boiled form, in different other forms, and there was no reaction, no complications, no problems at all. What do we learn out of it? Whenever such a strong causative modality is available, it gets the highest importance and it rules out over all the other symptoms. The child was allergic to eggs for nearly 7 years, manifested several reactions to it, recovered completely, and now he is able to enjoy eggs like fish takes to the water. If this type of children are brought to homeopathy early, I'm sure we can help many more cases like this and get better results. Such cases should be published and should be made available to the medical fraternity and also to the common suffering patients, thus creating awareness amongst the public so that we can create healthy world. Let's create healthy world together.